Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Good evening to all the amazing, beautiful people. How's everyone doing? I hope my voice is audible, visible to all the amazing people. I think yes, it's audible to me. Hello everyone, welcome to Pediatrics by Dr. Anand. Just let me know if my voice is coming so that we can start this amazing class. Is my voice coming? Hello, 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 hello. Yes, I hope it's coming once again. Yes, it is coming to me. Good evening, Dr. Mansi Panola. We have Dev, Preeti, Ara Nishashri, Sonu, Vipul Patil, Satya Narayan Jadhav, Rahul Madhuri Dikshit, Aviral, FMG friends, and Dr. Khalid. Good evening, everyone. Yes, exactly. Yes. I hope my voice is audible to everyone. Let's start this beautiful class. Hello everyone, welcome to Pediatrics by Dr. Anand. And this class, the topic, the thought of process in this class will be we're gonna revise some beautiful, amazing one-liners, images pertaining to pediatrics as your beautiful, amazing FMG exam is coming. First of all the amazing best to all the crazy students. I hope you guys are doing really great. So yes, let's start this class. Before starting any amazing segment, we always have a quick, beautiful, motivating quote. Today's motivating quote will be keep chasing your dreams. My dear friends, keep chasing your dreams. Why should I keep chasing my dreams? You should keep chasing your dreams whether you are tired or you are alone or you are heartbroken or you are F. So could you please think and tell me what is F in this line? Keep chasing your dreams, guys. You were born to rock, okay? You are the best. Tell yourself you are an amazing soul. Tell yourself you are the most beautiful soul on this planet, okay? And you can do anything in life. So you must keep chasing your dreams whether you are tired, you are alone, you are heartbroken, or F say you are frustrated. Okay, so that's the whole process. Positive, 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 positive. That's all you have to do. Okay. Yes, Dr. Rahul Tiwari says thank you, sir, for this session. Thank you, Dr. Rahul. We have Aditya, Khalid, and Khalid is saying something non-veg. Okay. Dr. Barad and Dr. Shubham. Dr. Shubham says hello, sir ji, namaskar. आपको कैसे हैं आप? We missed you. We missed you too, buddy. We missed you too. Can we start this class? Yes. Now the first question on this planet will be this. So let's have a very quick 30 to 40 minutes, some amazing crazy sessions, and try to answer as much as possible. The first question on this planet will be what is this cutie pie doing here? Could you please answer in the comment section? The first question is what is this whitish sticky discharge is there in this newborn baby? Such a beautiful angel has born on this planet, and what is this whitish discharge? Oh, yes, that's right. Dr. Neelam says English plus Hindi. हाँ जी. Okay, this session will be spoken in English and Hindi language. तो पहला सवाल आज का ये है कि मैं कैसा लग रहा हूँ. आई होप मैं ठीक लग रहा हूँ. दूसरा सवाल ये है कि इस बेबी को क्या है. That's very well put by Dr. Swaraj. Suman, this is nothing but Vernix caseosa. That's very right. Vernix caseosa. This material, this whitish sticky material which is there in the baby, that is known as Vernix caseosa. Caseosa. Number one, why it is there? Why God has made this Vernix caseosa? To prevent hypothermia, in the baby. I have a doubt. Should I clean this? Is the ward sister supposed to clean this Vernix caseosa? Should we clean this or wipe it out? Yes or no? The beautiful answer on this planet will be no, 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 no. You don't clean that. It's a very happy. This is like a. It helps in insulation, prevents hypothermia in a baby. That is why you should not clean this. The first image of choice is nothing but Vernix caseosa. The next important thing, yes, a very good one. What is this? A newborn baby not able to retract the penile skin. What do you call this condition? Is this condition normal or not normal? Could you please answer in the comment section? Shubhangi Kaushik, one of our very cute students, she says, good evening, sir. Missed you. Yes, Shubhangi, and I'm really happy that, Osama, Shubhangi, all the beautiful pillars of our life are there, so that's great. Yes, perfect. This is nothing but very important, my dear friends, must be knowing. This is nothing but phimosis. Not able to retract the penile skin is nothing but known as phimosis. Number one. Number two, again, and PG entrance question number one. A newborn baby, mother come to the pediatrician saying, doctor, I am not able to retract my baby's skin, my baby's penis skin. So what is the answer for this question? What will you do? Could you please answer in the comment section, yes or no? Aditya Sharma Sharma says it is abnormal. Okay, cool. Anyone else saying something? Okay. Ankit says very good. Dr. Ankit says I would like to do circumcision in this case. Okay. Do we have anyone else in the faculty who can answer? Okay. Dr. Live says, sir, will it be enough? There is nothing enough in this life, whatever we are trying to cover it up over here, some random important points. Just, gather some knowledge and keep revising your own subjects. It will be amazing. Beautiful. Suman, doctors, okay. Suman also says, I would like to do circumcision. And कुछ कोई और बंदा है जो थोड़ा सा दिमाग लगा सके. Okay, yes. We have a student, his ID is कहाँ चलेगी ID? I am FMG. उसने सही जवाब दिया था, फिर उसने सही जवाब को गलत वो रीड कर दिया. The answer for this question is a newborn baby coming to phimosis. A newborn baby, mother saying, doctor, I'm not able to retract my baby's penile skin. What should I do? The beautiful answer on this planet, the answer will be conservative management. Physiological phimosis is normal, bro. It is normal. A newborn baby in a newborn baby, we do not retract the penile skin. Physiological phimosis is always there in a newborn baby. Don't try to retract. It will start bleeding out, okay? So you don't retract the penile skin of a newborn baby because physiological phimosis is one of the conditions in a newborn which looks abnormal, where you all are saying we'll do circumcision, but the reality is this is a normal finding in a newborn. I'm talking about newborn. I'm not talking about you. If it is you have this problem, you definitely should go circumcision. It will be beneficial for you, but in a newborn baby it is normal. Next question, please. Yes, the next question. Perfect, beautiful. On our today only on our Instagram channel, we were beautifully discussing this. Okay, fine. Yeah. Okay. Continue. Hanji. Chalo. The next question. The next beautiful question on this planet will be Defi Rasi Rocks. Today only on our Insta page, I have had posted this picture on my daily ward rounds. One child was prescribed Defi Rasi Rocks. Could you please answer in the comment what is this drug? Where it is used and why it is used, and what is the dose of this drug. A very good DNB question. It could be a very smart DNB OSCE question. What is this drug? Why it is used? What is the dose? Could you please answer in the comment section? Perfect answer, beautifully told by Dr. Priya Gupta, Dr. Live, Dr. Ankit, and our Dr. Shubham, pyara bhai Shubham. That's very true, dude. This is nothing but, this is like a iron chelator. It's a chelator. It is an iron chelator. It will remove the excess iron in from my body. Defi Rasi Rocks and Deferoxime, there are drugs which is nothing but used in the chelation therapy of, any guesses? Thalassemia. The patient who are having thalassemia major, but nowadays we don't say like, we directly say transfusion dependent anemias and non-transfusion dependent anemias. Someone having a beta thalassemia major is usually a person of transfusion dependent anemias. Once you do so many transfusions to a baby, the hemoglobin level, the iron level basically goes very high. So that is why you must start the iron chelation therapy in the baby. Okay, Defi Rasi Rocks. So today in my ward rounds only, we had a patient of thalassemia major, and on that baby was an iron chelation therapy. Last question, could you please answer in the comment section how much dose, what is the dose of Defi Rasi Rocks? Could you please answer any random guesses? What is the dose of Defi Rasi Rocks in the case of thalassemia major or transfusion dependent anemias? In today only I have posted this question. Dr. Osama Sheikh. Osama has always been my favorite junior because he's there every class from last 1 year. That's why. Yeah. The answer is 20 mg per kg per day. You start off with 20 mg per kg per day and you can go till 50 mg per kg per day. Normally, this chelation therapy, Defi Rasi Rocks, we start with 20 mg per kg per day and we can go till 50 mg per kg per day. That much you should know. Yeah, Dr. Anum says 25 mg per kg per day chalega, but 20 से start करते हैं 50 तक जाते हैं. ठीक है? Next question, please. Let's have some quick one-liners in pediatrics. Question number 1. Which is the most common cause of beta thalassemia? Let's have some 10 important pediatric hematology and oncology one-liners. Could you please answer in the comment section which is the most commonest cause of beta thalassemia? And I'll not give you MCQs. Don't dream, sir MCQ बता दो, अकड़ बकड़ बम्बे बो करके एक आंसर तो सही हो ही जाएगा. So हाँ जी, कौन बताएगा? Who is a good boy? Manish Yadav, मेरा प्यारा भाई. So the answer will be splicing mutation. Splicing mutation is the most common as a cause of beta thalassemia. this 30 minutes of class, try to put your best of the best intention and imagine you are reading this for the first and last time, so I'll repeat again. In this beautiful class, one thing I understood was vernix caseosa. The second image I saw was physiological phimosis. It is normal in a newborn. You do not do circumcision of a newborn baby having phimosis. Next, we understood deferasirox used for iron chelation therapy in a case of transfusion dependent anemias. When I'm having a iron overload, you give me deferasirox. Okay, and also one more thing I would like to mention here: when someone is on iron therapy, when someone is on iron chelation therapy, please check the serum creatinine of this patient. Too much of deferasirox can have a kidney injury, so serum creatinine levels should always be measured on the follow-up of a patient who is on deferasirox. Then also we understood the most commonest cause of beta thalassemia is a splicing mutation. Next question, please. Which is the most common bone which is involved in Langerhans cells histiocytosis? Yes, can you please answer in the comment section? Yes, Dr. Shubham says आपकी वाई भी अलग है, यही चीज हम लोग मिस कर रहे थे. Yes brother, आई एम सॉरी मैं इतने दिन से ऑनलाइन नहीं आ पाता क्योंकि मेरी सेरेबेलम अकेडमी मैंने ज्वाइन की है डॉक्टर अपूर्व मेहरा और डॉक्टर जैनब वोरा और डॉक्टर गोविंद राय घर के साथ. सो मेरी बहुत सारी रिकॉर्डिंग्स चल रही हैं और कुछ 1-2 महीने बाद बहुत धूम धड़ाके से मेरे बहुत सारे भर के वीडियोस आने वाले हैं. सो आई एम जस्ट घर बैठ के रोज़ मैं रिकॉर्डिंग कर करके अपनी हमारी ऐप को, सेरिबेलम ऐप को हम प्यार मोहब्बत से भर रहे हैं और तूफान आने वाला है, बहुत मजा आएगा. सो विच इज़ द मोस्ट कॉमन बोन इन्वॉल्व इन Langerhans cell histiocytosis? Can you please answer in the comment, please? The answer for this question will be ABCD. Dr. Shanmughan is right. Dr. Madhuri Gupta, Dr. Mansi Panola. Yes, skull is the most beautiful answer. You are very, very right. Dr. Meghna Gaur says, sir, how long we give iron chelation therapy? There is no specific time we give iron chelation therapy. You just check the serum ferritin levels. If the serum ferritin levels is crossing the more than 1000, that means the patient can land up into iron toxicity and you automatically start the deferasirox. It will goes for many months actually. On the follow-up, you do a repeat serum ferritin, serum iron levels. If it is less than 1000, then okay, 1000 or more than 1000, it's like a toxicity. Start deferasirox. There is no specific duration they have given. Follow up the patient, do repeat testing, and accordingly you can taper it up. Okay. The most common bone involved in Langerhans cells histiocytosis is the skull. Next question. Which is the most common mode of inheritance of von Willebrand disease? Beautiful question. Autosomal dominant or autosomal recessive? Can you beautifully answer in the comment? Yes, Sarthak Praharaj, one of our very good student he is. I am in touch with him regularly these days. Beautifully told by, yes, Dr. Barar, Dr. Sarthak, Rishi Mishra, Meghna, Hari Rajput. Perfect. Okay. So the most common mode of inheritance of von Willebrand disease, I hope you know that. Yes, Dr. Sarthak, thank you for adding extra points. Autosomal dominant, very true. Autosomal dominant inheritance is there. The most common mode of inheritance, for this one, von Willebrand disease is autosomal dominant. Can we link and study, please? Can you please tell me any random one more disease which is autosomal dominant? Dr. Sarthak, could you please answer? Dr. Keshav Avasti says, Namaste sir. Namaste pranam. हाँ जी, क्या हम इस दुनिया में कोई और बीमारी का नाम बता सकते हैं जो ऑटोसोमल डोमिनेंट होती है? कौन सुंदर व्यक्ति बताएगा? कितनी शुद्ध हिंदी बोल रहा हूं मैं. नीलम, यस, परफेक्ट. व्हाट अबाउट विल्सन डिजीज? विल्सन डिजीज इज ऑटोसोमल डोमिनेंट और ऑटोसोमल रिसेसिव? कैन यू प्लीज आंसर? डॉक्टर निगार अंसारी, ब्यूटीफुल डियर. achondroplasia, yes dude, you're very right. So Wilson disease, achondroplasia, even exactly beautiful. Yeah, even Treacher-Collins syndrome also, that's true. Marfan syndrome also, that's very, Dr. Shubhangi, very good. Okay, at least yeah, exactly, very true. That's very well put. So you are very right. Achondroplasia, Marfan syndrome, very important. These all are conditions with what you call autosomal dominant. The mnemonic, you remember, Matt, like the autosomal dominant itself, the mnemonic is dominant, but I'll not go there. Remember just three things: M for Marfan syndrome, A for achondroplasia, and T for Treacher-Collins syndrome. Treacher-Collins syndrome. At least if you don't remember anything else, at least this much I want you guys to remember. Like, forget the Wilson, at least I want you to remember one thing. Exactly. The mnemonic is MAT, M-A-T, Marfan syndrome, achondroplasia, and Treacher-Collins syndrome. These all are autosomal dominant inheritance. That's all you should know. And von Willebrand disease also. Okay, perfect. Next question. Which is the primary intraocular tumor in children? Which is the primary intraocular tumor in children? Can you beautifully answer in the comment section? Dr. Live, Neelam, Shubham, Priya, Swaraj, azithromycin, macrolides. There's an ID known as azithrom. That's crazy. Vikram Singh, great. Which is the most common primary intraocular tumor in children? Dude, these all, इसमें से 4-5 क्वेश्चन तो ऐसे उठ के आ जाएंगे अगले अगले हफ्ते तुम्हारे एग्जाम के अंदर. The most common primary intraocular to, yeah, exactly. Yeah, tumor is nothing but retinoblastoma. Yes, beautifully told by Priya Gupta, Suraj, काव्या, मानसी, सार्थक, हरि. इतने सारे लोग क्या करने आए? बारात आई है, बारात है किसी की. 150 लोग ऐसे ही आ गए. Very good. The most common primary intraocular tumor in children, bro, is nothing but retinoblastoma. Please remember that. Which is the most common presentation of retinoblastoma? Very good question. Which is the most common? Yes, Dr. Live has already answered. Already he has answered. The most common presentation of retinoblastoma is nothing but, we all know that, white pupil, leukocoria. The most common presentation of retinoblastoma is leukocoria, nothing but white pupil. That's right. Yehi Hanji FM. You're right, bro. Perfect. Very good. Next question, please. Which is the most common malignant or orbital tumor in childhood? Can you quickly answer in the comment, please? Which is the most common primary malignant or orbital tumor in childhood? What do you think? What do you think? Sir, option देंगे तो बता देंगे. क्यों option क्या? Option तुम्हारे रिश्ते में आए. Option रिश्ते नहीं दूंगा. Option आंसर क्या बताओ मुझे इसका? The most common primary malignant or orbital tumor in childhood is what? Any guesses? Yes, rhabdomyosarcoma. The most common primary malignant, okay, malignant, not benign, malignant orbital tumor in childhood is nothing but rhabdomyosarcoma. Please remember. Let's have a quick revision, guys. Quick revision. So in this beautiful class, what did we understood? We understood, number one, that we must keep chasing our dreams even we are tired, alone, or heartbroken. And also at the same time, the first image we understood was vernix caseosa. The second image we understood was physiological phimosis, where you don't have to do anything for this. Then also we understood deferasirox was there in the chelation therapy for thalassemia major or transfusion dependent anemias. Then also I understood that the most common cause of beta thalassemia is the splicing mutation. The most common bone involved in Langerhans cells histiocytosis is the skull. Then also I understood that von Willebrand disease is autosomal dominant in fashion. And forget about Wilson. The mnemonic was MAT. MAT is something I wanted to remember. Marfan syndrome also is autosomal dominant. Achondroplasia is also autosomal dominant. And Treacher-Collins syndrome also is autosomal dominant inheritance, not Wilson. Then also we understood one beautiful point that the primary intraocular tumor in children is nothing but retinoblastoma, and the presentation the patient will come will be a white pupil, nothing but leukocoria. And the primary malignant orbital tumor will be a rhabdomyosarcoma. The next question, please. Which is the most common pediatric soft tissue sarcoma? Which is the most common pediatric soft tissue sarcoma? We have Dr. Peace. He says, sir, could you please save the live to watch later? Yes, buddy, this video will be beautifully saved so that you can watch it later. The most common, so we have 10 questions on hematology, 10 questions on respiratory, 10 questions on cardiac. Like that, I'm thinking of covering multiple system, 10-20 questions I'm gonna ask you. If you don't answer, then I will kill you, nothing else. The most common pediatric soft tissue sarcoma is again same dude, rhabdomyosarcoma. Okay, rhabdomyosarcoma. Please remember that. Beautiful. Sarthak Praharaj, बहुत अच्छी बात है. Next question, please. This part is over. Now we have covered the 10 important questions on the hematology and oncology. Now the next important part will be on the respiratory system. The questions for respiratory systems will be, number one, which is the most common congenital laryngeal anomaly? Which is the most common congenital laryngeal anomaly? Larynx का congenital problem क्या हो सकता है? Larynx का most common laryngomalacia, laryngeal web, laryngeal stenosis or laryngeal cyst. A, B, C, D. You have 10 seconds to answer this question. Could you please answer? 10 seconds. Your time starts now. Okay. बिन तेरे कोई खलिश है हवाओं में, बिन तेरे Yes, that's very right. Bintere, not Bintere. The answer is laryngomalacia, bro. The most common congenital problem of my larynx will be laryngomalacia. That we must appreciate. And also, I am a FMG students. Could you please tell me 5 important points on laryngomalacia, please? Exactly. Dr. Stark has already told. Number one, the patient will have a omega shape epiglottis. Okay, I agree with you. Anything else? Anything else? डॉक्टर नरुत्तो सेज सर पढ़ाई ही नहीं पा रही, एंग्जाइटी हो रही है। छोटे छोटे टाइम टेबल बनाइए प्लीज़, 40 मिनट्स का, 1 आवर का। एक कॉपी पेन लो, सुबह 9 बजे से टाइम टेबल बनाओ कि 9 to 9:30 मैं ये पढ़ूंगा, और फिर 5 मिनट्स का ब्रेक लो। अगर बहुत लंबा टाइम टेबल नहीं बन पा रहा तो छोटे छोटे टाइम टेबल बनाइए और फिर उसमें ब्रेक्स दीजिए अपने आप को। तो छोटे टाइम टेबल में अगर छोटे टाइम के लिए पढ़ोगे तो ज़्यादा फोकस रहेगा। 4 घंटे में लगातार पढ़ के ब्रेक लूँगा, हवा में जाएगी सारी बात। ठीक है, दैट्स राइट। यस, डॉक्टर बलराम इज ब्यूटिफुल राइट। दिस laryngomalacia, basically the distress increases in supine position and decreases in prone position. I totally agree with you. Or any other two more points. Yes, it is the most commonest cause of stridor in pediatric age group. The most commonest cause of stridor in children is nothing but laryngomalacia. That is one thing you should know. And the last but not least, what's the treatment? Which surgery we do? Nothing, sir. Conservative management. Conservative management. These are the 5 important beautiful points on laryngomalacia. Yes, exactly. Dr. Swapnika Singh says, you are FMG, sir. I am FMG. No, dear, I did my graduation from Bangalore, Ambedkar Medical College. Then I did my MD in pediatrics. Then SR Street from Lady Harding and Hindu Rao. And then I became assistant professor and very happy with life. Okay, so in this slide, we beautifully understood that the laryngomalacia, you see a omega shape epiglottis, the distress increases in supine and decreases in prone. It is the most commonest cause of stridor in a child, and there is no such, like, conservative management is there, because after 6 months of life, that flappy omega shape automatically will be, the flaccidity, the flappiness of this epiglottis, that omega shape will be better. It will reduce, it will become normal. So that's what. Next question, please. Which is the most commonest cause of stridor in neonatal and young infant? ABCD. Which is the most common cause of stridor in neonatal and young infant? ABCD. Yes, that's true. The answer is nothing but laryngomalacia. So A is the best answer, laryngomalacia. My beautiful laptop says battery is low. Okay, fine. Next question, please. Which is the most common benign tumor of the lung? Which is the most common benign tumor of the lung? Can you please answer in the comment, please? Ashutosh says, come to Chandigarh, sir. Ashutosh also is one of my very good friends. He's in touch with me. We have a private WhatsApp group. Osama, Shubhangi, Shubham, Manish, Ashutosh, Jalpit, and Moni Mala. Beautiful people we have in a very close circuit. And one of our favorite junior, R.R. Nishashri also. The most common benign tumor of the lung is nothing but hematoma. The most common benign tumor of the lung is nothing but hematoma. Please remember that. Next one, please. Which is the most common cause of neonatal pneumonia? Good question. Which is the most commonest cause of neonatal pneumonia? Actually, it is age-wise, but chalo, at least if randomly if I ask you this question, A, B, C, D, what is the best answer? Could you please answer in the comment, please? A, B, C, D. A, B, C, D karo, dil ki suno. Yes, you have 10 seconds to answer this question. Yes, yes, yes. गाना सुना है? ओके फाइन. सब गाते हैं, सब ही मदहोश हैं, हम तुम क्यों खामोश हैं. So that's what, dude. Neonatal pneumonia, bro. Group B, streptococci is the most commonest answer available on this planet. Dr. Abhishek Mishra, thank you, sir. Thank you. Love you a lot. So the most commonest cause of neonatal pneumonia is nothing but group B, streptococci. And again, 2022, recent last year question, dude. What is pneumonia and what is severe pneumonia? Can you please answer in the comment? I'm gonna ask you a lot of questions, okay? और अगर गलत आंसर दिया तो पता क्या मिलेगा? You will get, what is this? Can you please identify this thing? You have had this thing in your life multiple times. हमने तो बचपन में खूब मार खाई है भैया, तो चप्पल पड़ेगी अगर गलती से किसी ने गलत आंसर दिया तो. ठीक है, perfect. That's very well put. That's right, dude. Perfect. Dr. Samar Thakur has the right answer. So yes, very, very true. So what is pneumonia? As we all know, fast breathing with or without chest indrawing. That's right, dude. Fast breathing with or without chest indrawing is nothing but known as pneumonia. क्या बच्चे की सांसें तेज चल रही हैं? हाँ जी, चल रही हैं। कैसे पता चलेगा बच्चे की सांसें तेज चल रही हैं? हमारे पास WHO का कट ऑफ है फास्ट ब्रीदिंग का। हाउ विल आई गेट टू नो वेदर बेबी इज हैविंग फास्ट ब्रीदिंग? सो वी हैव अ WHO कट ऑफ फास्ट ब्रीदिंग, 0 to 2 months of life, 3 months to 1 year, 1 year to 5 year, and more than 5 year. I'll repeat again, we have this WHO cutoff of the fast breathing. Any baby who is between 0 to 2 months of life having respiratory rate more than 60 per minute is known as fast breathing. And then we have more than 50, more than 40, more than 30. Okay, that is a beautiful one. Exactly. Yes, Dr. Naruto, you're very, very right. Okay, शुभांगी कह रही है शुभम आज बच गया हम बच गए हम चप्पल से। वेरी गुड बेटा, मार खा खा के ही बड़े होते हैं सब लोग। सो कोई रिश्तों में मार खाता है तो कोई कैसे मार खाता है। मुझे इससे वो शेर याद आ गया, पुराने वाला याद है। वो हमने एक शेर हमने एक सुनाया था, तुझे प्यार करना नहीं आता, मुझे प्यार के सिवा कुछ नहीं आता। तुझे प्यार करना नहीं आता, मुझे प्यार के सिवा कुछ नहीं आता। दुनिया में जीने के सिर्फ दो ही तरीके हैं, एक तुझे नहीं आता और एक मुझे नहीं आता। So yes, that's right. So fast breathing with or without chest and drawing is known as pneumonia. And if there are danger signs, that is known as severe pneumonia. Please remember, now there is nothing known as very severe pneumonia. Very severe pneumonia जैसा कुछ नहीं होता है, खाली pneumonia होगा या severe pneumonia hoga. Very, very true. Yes. And what is the treatment for that, dude? So treatment for that, we all know that for severe pneumonia you will give amoxicillin, augmentin देंगे। amoxicillin drug आता है, we give amoxicillin for 5 days for pneumonia. If the patient has a severe pneumonia as in fast breathing with or without chest and drawing and danger signs, danger sign as in बच्चा फीड नहीं ले रहा, danger sign as in बच्चे को सीजर आ रहे हैं, danger sign as in बच्चा शॉक में है, या बच्चा बहुत ही लेथार्जिक या रेस्टलेस है, मतलब काइंड ऑफ एक इम्पेंडिंग फेलियर में जा रहा है, कहने की बात है। तो दैट विल बी डेंजर साइंस। एंड उसमें हम क्या देंगे? एम्पीजेंटा, ampicillin and gentamicin for 5 days. Okay, it's a recent 2022 question. Please don't forget. Please, please, please. 30 minutes of class is over. Only 10 minutes are left. Please let me know, has everyone understood this much? Yes or yes? Please let me know in the comment, तभी हम आगे बढ़ेंगे, वरना मैं नहीं पढ़ा रहा। सार्थक कह रहा है ऑगमेंटिन क्या है सर जी? ऑगमेंटिन मतलब ब्रो डियर सार्थक, ऑगमेंटिन ना इज अ ब्रांड नेम। Augmentin is a brand name. Augmentin is nothing but it's a composition of amoxicillin and clavulanic acid. Amoxicillin and clavulanic acid. Okay, Augmentin brand name है जिसमें ये दो ड्रग होते हैं। ये फार्माकोलॉजी में क्वेश्चन आता है कि why amoxicillin is preferred with clavulanic acid. The absorption amoxicillin का बढ़ जाता है एक्चुअली, और पूरा एक लंबा चौड़ा फार्माकोलॉजी में मैकेनिज्म है why amoxicillin is preferred with clavulanic acid. We have individual syrup amoxicillin also, but it's good if you give amoxicillin with clavulanic acid, and the brand name for that is a very famous drug known as syrup augmentin. ठीक है। आशुतोष कह रहा है you are the best bro। ठीक है। अच्छा, ये क्वेश्चन नहीं है मोस्ट कॉमन कॉज ऑफ पल्मोनरी हाइपोप्लेजिया, नहीं, ये क्वेश्चन यहाँ हम हटा देंगे क्योंकि इसमें कुछ चेंजेस हो गए हैं। लेट्स टॉक अबाउट दिस डायफ्रामेटिक हर्निया, और आई वुड से कंजेनाइटल डायफ्रामेटिक हर्निया। सो आई एम अ FMG स्टूडेंट, कुड यू प्लीज टेल मी सम 5 इंपॉर्टेंट पॉइंट्स ऑन कंजेनाइटल डायफ्रामेटिक हर्निया? अगर एग्जाम में क्वेश्चन आ गया तो मैं क्या लिख के आऊंगा? व्हाट शुड आई राइट फॉर कंजेनाइटल डायफ्रामेटिक हर्निया? कैन यू प्लीज आंसर इन द कमेंट प्लीज? डॉक्टर सूरज कुमार, थैंक यू बडी। नीलम, यस एग्जैक्टली, आप पूरे दिन भी पढ़ाओगे तो भी पढ़ लूंगी। थैंक यू, दैट्स वेरी काइंड ऑफ यू, थैंक यू, लॉट्स ऑफ रिस्पेक्ट एंड लव फ्रॉम माय साइड। सो कंजेनाइटल डायफ्रामेटिक हर्निया, कंजेनाइटल मींस बाय बर्थ, डायफ्राम का क्या है? हर्निया है। डायफ्राम, यू नो, वी ऑल नो दैट ब्यूटीफुल डायफ्राम विच सेपरेट्स द थोरैक्स फ्रॉम द एब्डोमेन, उसमें क्या हो गया है? हर्निया हो गया है। हर्निया क्या होता है? हर्निया में कुछ नहीं होता, बस टाइम पास होता है, कुछ नहीं होता। द इंटेस्टाइनल कंटेंट्स बेसिकली गो टुवर्ड्स द लेफ्ट साइड ऑफ द चेस्ट। chest. There's a herniation, protrusion basically, like a one part of the bowel has gone to the left side of the chest. And as because the one part of bowel has gone to the one part of the chest where left side is more common, lungs जो है एक स्पंज की तरह होते हैं. लंग्स जो है एक फॉर्म एक स्पंज की तरह होते हैं, वो अपने आप पिचक भी सकते हैं, खुल भी सकते हैं, तभी हवा ऐसे इन्फ्लेट डिफ्लेट होती है. सो वंस इंटेस्टाइन हैज गॉन अप, वो लंग्स को क्या करती है, पिचका देती है. इट कॉजेज कोलैप्स ऑफ द वन साइड ऑफ द लंग and kind of a mediastinal shift basically, or tracheal shift also of the other segment, basically on the other segment. Number one, the five important points which I can appreciate is: number one, the baby will have distress. Obviously, then if your intestine has gone to the left side of the chest, you will have distress. The most commonest type of congenital diaphragmatic hernia, we all know that, is the posterolateral variety, which is also known as Bocker-Dulac hernia. Bocker-Dulac hernia, that is number 1 point. The patient will have a scaphoid shape abdomen. Very well true. Dr. Samar Thakur says lung ka hypoplasia ho jayega. You all guys will definitely get a rank. Just stay positive. You're answering so good. Everyone is so amazing over here. Very good. Shubham is right. We have multiple types of hernia in congenital diaphragmatic hernia, like a Bock-Dulac hernia or the Morgagni hernia. Bock-Dulac is the posterolateral variety, whereas anteromedial variety is nothing but Morgagni hernia. So that's what. So the 5 important points of the congenital diaphragmatic hernia: the baby will have distress. Posterolateral variety, the Bock-Dulac hernia, is the most common type. The baby will have a scaphoid shape abdomen because the intestine has gone up. So the abdomen एक बोट एक scaphoid की तरह हो गया है और लंग का हाइपोप्लेजिया हो जाता है. And very very important, क्या हम कुछ मिस कर रहे हैं? Yes, this ID, the ID, very hi-fi ID, 26 med संदेश आगे क्या लिखा है, संदेश Shri Sagar has right answered that bag and mask ventilation is completely contraindicated. One important contraindication of bag and mask ventilation is nothing but congenital diaphragmatic hernia. Now I have a question. If you can answer me, let's see. My question is, what is the indication? I will give you right now, I will give you rupees 100 Paytm to the first Shrotagan. Shrotagan की English क्या होती है? First candidate. You can tell me what is the indication, what is the prime indication of bag and mask ventilation. Your time starts now. ऑपरेट ही करेंगे ब्रो. सार्थक प्रहाराज, कंजेनिटल डायफ्रामेटिक हर्निया, इसमें एक इंपॉर्टेंट पॉइंट आता है. That's right. ऑपरेट ही होगा. और एक और चीज आती है, one more thing is there. If someone having a congenital diaphragmatic hernia, as you will directly, what you called, you will not do bag and mask, no, directly you'll put the patient on ventilator. That is one more examiner had asked me this question. What is the one condition in the neonatal resuscitation where you just put the baby on ventilator? So obviously it will be congenital diaphragmatic hernia because bag and mask is contraindicated. Baby is having distress and all that. So then the next option will be definitely ventilator. That's what. Okay, who has the answer? Let me just see. Okay, Shubham कह रहा है हार्ट रेट more than 100. तो घर पे आके मारूंगा, घर पे आके more than 100. बेटे तू जिम के बाहर मिल, तेरे को more than 100. किसी सुंदर व्यक्ति ने आंसर किया है. किसने? मेरे मोबाइल के हिसाब से, ठीक है, लड़ाई नहीं करनी. Priya Gupta has told the right answer. The heart rate is less than 100. The main indication of bag and mask ventilation is nothing but heart rate less than 100. तब हम bag and mask को हाथ लगाते हैं मेरे मोबाइल के हिसाब से. Priya Gupta has beautifully told the right answer. Priya Gupta, you have my number, I think. WhatsApp me, okay, and I'll Paytm you quickly. Next question, please. Which is the most commonest cause of common cold, guys? Could you answer in the comment? 40 minutes are over. Just 5 more minutes and this class is done. Which is the most commonest cause of common cold? Who will tell me? Please, who will tell me? सार्थक बताएगा. हाँ जी, अजय पाटिल, yes is right. अच्छा, okay, perfect. So the most commonest cause of common cold will be rhinovirus. We all know that it's a rhinovirus. Hari Rajput is right. Okay, हाँ जी, अंकित कह रहा है if the heart rate less than 60 होगा तो क्या करेंगे? As we all know, dear, if the heart rate is less than 100 beats per minute in a newborn baby, you do bag and mask ventilation. If the heart rate is less than 60 in a newborn baby, then you do chest compression plus bag and mask ventilation. You do it for 60 seconds in the ratio of 3:1. I'll repeat again. If एक बच्चे का अगर heart rate 100 से कम है तो आप 30 सेकंड्स के लिए बैग एंड मास्क वेंटिलेशन करते हैं. अगर एक बच्चे का हार्ट रेट 60 से कम है तो आप आप चेस्ट कंप्रेशन प्लस बैग एंड मास दोनों करते हैं, आप 60 सेकंड के लिए करते हैं, इसका रेशियो होता है 3:1, मतलब 3 बार चेस्ट कंप्रेशन और 1 बार बैग एंड मास वेंटिलेशन। इट्स लाइक 1 2 3 1 1 2 3 1, बट रिमेंबर दिस 1 2 3 मोर देन द फिंगर टेक्निक, थंब टेक्निक इज बेटर। हम 60 सेकंड के लिए करते हैं। 60 सेकंड के बाद भी अगर बच्चे का हार्ट रेट लेस देन 60 आया तो हम एड्रेनलिन देते हैं, जो हम देते हैं 0.1 to 0.3 ml पर kg इन 1:10,000 डाइल्यूशन। ये भी लास्ट ईयर एग्जाम में आ चुका है, नर्सिंग एग्जाम में आया था ये। तो अगर हार्ट रेट लेस देन 60 बीट्स पर मिनट आता है आफ्टर 60 सेकंड्स ऑफ बैग एंड मास चेस्ट कंप्रेशन एंड बैग एंड मास, देन यू गिव एडीआर एट द रेट ऑफ 0.1 to 0.3 ml पर kg इन 1:10,000 डाइल्यूशन। अब लेटेस्ट जो एनआरपी 8th एडिशन, जो 8th एडिशन लेटेस्ट आ गया, वो लोग कहते हैं कि एडीआर का डोज 0.2 ml पर kg इन लोगों ने कर दिया करके, 0.2 ml पर kg। ये बिल्कुल लेटेस्ट एनआरपी 8th एडिशन कहती है, पुराने वाले में लिखा था 0.1 to 0.3 ml। नेक्स्ट क्वेश्चन प्लीज। Which is the most commonest cause of pharyngitis? Rhino, RSV, Epstein-Barr virus, or adenovirus? Can you please answer? Yes, your time starts now. The class is coming to an end, guys. Thank you so much for being there. Could you please answer in the comment? Just 5 more minutes, then you will go to your house and I will do recordings for Cerebellum. Yes. So yes, Sneha, Shubhangi, Hanji, Vipul. Perfect, perfect. What do you think? ABCD. Quick answer. You have 5 seconds. 5 seconds to go. धीरे धीरे बोल कोई सुनना ले, सुनना ले कोई सुनना ले। द मोस्ट कॉमनेस्ट कॉज ऑफ कॉमन कोल्ड विल बी राइनोवायरस, pharyngitis will be adenovirus, right? कॉमन कोल्ड का मोस्ट कॉमनेस्ट कॉज होता है राइनोवायरस, pharyngitis का मोस्ट कॉमनेस्ट कॉज होता है एडिनोवायरस, और एंड ऑल्सो हाँ एडिनोवायरस में बोले तो एडिनोवायरस, अदरवाइज स्ट्रेप्टोकोकस पायोजेंस। ओके, वायरस में एडिनोवायरस रहेगा आंसर, ठीक है। एंड विच इज द मोस्ट कॉमनेस्ट कॉज ऑफ क्रूप? मेरे को बताइए, कैन आई आंसर प्लीज? मुझे आता है, यस मुझे आता है। हाँ जी, द मोस्ट कॉमनेस्ट कॉज ऑफ क्रूप, प्लीज मोस्ट कॉमनेस्ट कॉज, ऐसे क्वेश्चन अपने माथे पे लिख लो, बहुत इंपॉर्टेंट है ये क्वेश्चन, बहुत बार आते हैं। द मोस्ट कॉमनेस्ट कॉज ऑफ क्रूप इन अ चाइल्ड, हु विल आंसर in the comment? Okay, we have Dr. Naruto who says RSV. Before I kill you, please remember respiratory syncytial virus is the most commonest organism for bronchiolitis. Dear, bronchiolitis. किसी को bronchiolitis है तो most commonest cause होगा RSV, respiratory syncytial virus. The most commonest cause of croup will be para-influenza virus. एक्सरे में क्या मिलता है क्रूप में? कौन बताएगा? Who will tell me? Yes, guys. Could you please tell me? यस, परफेक्ट परफेक्ट परफेक्ट। व्हाट इज द एक्सरे में क्या मिलता है क्रूप के अंदर? क्या मिलता है? एनी आइडिया? ओके, आई गिव यू ऑप्शंस। आई गिव यू 2 इंपॉर्टेंट ऑप्शन। डू यू सी थंब साइन in a what you called X-ray of croup, or you see figure of 3 appearance in a X-ray of croup? The options are: option number A, X-ray of croup, you see thumb sign; option number B, you see figure of 3 appearance; option number C, figure of 8 appearance you see in the what you call X-ray of croup; or option number D also, let me give you, you see a box shaped heart in a case of croup. So the last question, this class is over now guys, 45 minutes are over. okay, बातों बातों में पता भी नहीं चला, पर पौना घंटा खत्म हो चुका है, अब क्लास यही खत्म करनी होगी हमें। ये आखिरी सवाल है आज का कि भाई क्रूप में एक्सरे में क्या मिलता है? ऑप्शंस आर: ए थंब साइन, बी फिगर ऑफ 3 अपीयरेंस, सी फिगर ऑफ 8 अपीयरेंस, एंड डी इज द बॉक्स शेप हार्ट। कौन बताएगा? हाँ जी, कौन बेइज्जती कराना चाहेगा अपनी? वेरी गुड। ओके, ओके। Sonu says B. Okay, we have Shifran Hussain says case boss. Yes, buddy. Yes. Dr. Sarthak Praharaj has told the right answer: A, B, C, D, E. So the best answer will be all are wrong. The best answer is in the croup. Basically, you see steeple sign. Steeple sign you see in a case of croup. कोई भी ऑप्शन सही नहीं था एक्चुअली, बस डैडी का मन किया, डैडी ने ऐसी एक क्वेश्चन बना दिया। तो आई रिपीट अगेन, क्रूप में एक्सरे में स्टीपल साइन मिलता है। थंब साइन कहाँ मिलता है? एक्यूट एपिग्लोटाइटिस में आपको थंब साइन मिलता है। फिगर ऑफ 3 कहाँ मिलता है? कोआर्कटेशन ऑफ एयोर्टा में मिलता है फिगर ऑफ 3 अपीयरेंस। फिगर ऑफ 8 कहाँ मिलता है? सुपराकार्डियक टीएपीवीसी में मिलता है फिगर ऑफ 8 अपीयरेंस। ठीक है, टीएपीवीसी क्या होता है? टोटल एनोमलस पल्मोनरी वीनस कनेक्शन। मोती की तरह हमने कार्डियोलॉजी को खत्म किया है, मतलब पीएचडी लेवल कार्डियो खत्म किया है, तो वी ऑल आर रियली हैप्पी फॉर दैट। सो फिगर ऑफ 3 अपीयरेंस यू सी इन कोआर्कटेशन ऑफ एयोर्टा, फिगर ऑफ 8 अपीयरेंस यू सी इन सुपराकार्डियक। यस। आवाज आ रही है या नहीं आ रही? Please let me know in the comment section. There was a quick, my laptop battery had gone, that's why. So is my voice coming? Yes or yes, yes. आवाज आ गई? Thumbs up, put a thumbs up if my voice is coming to all of you. I hope my voice is coming to all of you. Yes, it's coming. Perfect. Yeah, so that's what this was the last slide, dude. So what did we understand in this slide? I have understood the most commonest cause. मेरा pen क्यों चल रहा? हाँ, one thing we have understood that the most commonest cause of croup will be para-influenza virus, number one. Then also we have understood in this part that thumb sign basically you see in acute epiglottitis, steeple sign you see in a case of croup, figure of 3 appearance you see in coarctation of aorta, and figure of 8 appearance you see in supracardiac TAPVC. That's it. That finishes this class. Thank you so much, everyone. That finishes this class. And before leaving, we must have the beautiful quote. And today's beautiful quote will be: there are three solutions to every problem. Number one, you accept the problem, accept it, change it, or leave it. If you have a problem, number one, accept it. If you can't accept it, change it. If you can't change it, then just leave it. Thank you so much, everyone, for this beautiful participation. I hope you guys have understood something. This was today's amazing class, and the best of luck for all of you for the amazing FMG exam. Tell yourself you are a wonderful soul. Tell yourself you are amazing soul. You will crack a seat, okay? It was there for you. You were born to have it. So just open your common sense once you go to the exam. My sincere request to all people: don't think a copy paste question answer will come. Just open yourself, open your brains, use your common sense. If you are the doctor on duty, what answer you would have chosen, like that you do, okay? The examiner is not going to give you exact copy paste answer. It will be the closest best answer. So you have to use your brains, okay? And then everything will make sense by the end of the journey. Thank you. Thank you so much, everyone. Please take care of yourself. Yes, yes. And that's it. Thank you so much. And before leaving, motivational song, Bharat Mata Ki Jai, or should I say motivational song? I don't remember any song right now. But okay. Okay. तुझको देखा तो ये जाना, तू ही मेरी मंजिल है, सांसों के बिन शायद जी लूं, तुझ बिन जीना मुश्किल है, सीने में दिल है, दिल में है धड़कन, धड़कन में है तू ही तू, ओ मेरी पहली तमन्ना है, मेरी आखिरी आरज़ू, I love you. Thank you so much, everyone. I had a comfortable time talking to you all. I hope you had a okay time. Please take care. Bye bye. Any doubts you have my mobile number, and we have our WhatsApp group for newcomers. My number is 9999897081.